so let's hop back into the case, starting with this video.
In which a child is reported to have died. Do you have concerns about that?
We are following the measles epidemic every day. There are 2 people who have died. There have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual.
So misinformation has consequences. Let's talk about what's really happening. In the last video, we broke down a measles case, if y'all came to the correct diagnosis. Now let's talk about what this means. This child had a completely preventable disease, but instead we're seeing cases again, cases that shouldn't exist. Now, in addition to supportive care, like fluids, medications for your fever, high doses of vitamin A, and isolation, this is pretty much all we can offer. But here's the reality. No amount of care in the emergency department can erase the damage that measles can do. So what are the facts? Measles was declared eliminated in the United States in 2000, thanks to vaccines. We hadn't seen a single case in some areas since 2015 until now. Measles can kill, and those are just facts. And we have seen that, unfortunately, this week. So let's talk about the complications of measles. I'm a board-certified emergency physician, and these are the complications that we fear. So measles can directly affect your T cells, which can lead to systemic immunosuppression, meaning your body does not have the ability to fight off infections well. And so that can lead to secondary infections. It can cause pneumonia, encephalitis, hepatitis, appendicitis, long-term complications, and obviously death. Now let's go back and talk about what encephalitis is. Measles can cause something called subacute sclerosing panencephalitis, something that is fatal, progressive disease of your central nervous system. There is no cure for that. And as a refresher about measles, which is also called rubeola, patients can be contagious from about 4 days before they see the rash to about 4 days after. It is highly contagious, especially in communities where herd immunity is low, as well as unvaccinated. When should you consider this diagnosis? A patient of any age who has a rash and a fever. So that pretty much narrows it down to a lot. Having a high fever, cough, something called coryza, and conjunctivitis, which can last a few days. These spots are called Koplik spots that are in your buccal mucosa, which can kind of allude you to the fact that you're dealing with measles. So immediately what you want to do for these patients, isolate them, inform your public health department, and then supportive care. You can test for this with a PCR. Anyone who comes in contact with these patients should be wearing N95, and the patient should be wearing a mask. We send our condolences to the family who has lost a beautiful child, a child who did not deserve this. This is what happens when misinformation spreads, putting other kids at risk by weakening herd immunity. Herd immunity protects babies who are too young, people who are immunocompromised, and cancer patients who can't fight off these infections themselves. I'm a board-certified ER doctor, and I will be vaccinating my children. And what we're seeing right now with RFK in this new administration, with the rise of vaccine misinformation, is completely unacceptable. Misinformation kills. We saw it with the pandemic, and we're seeing it now. But here's the good news. Science works. Vaccines work. Protect your kids. Protect all kids. We have the power to stop this.